So the talk given to me is the challenges during and post COVID 2019, and we all have spoken about this diabetes and its complication threaten global health. And in India, we have this diabetic retinopathy, the leading and potentially preventable cause of visual impairment and blindness. And our entire group here in this IC is doing that. And caring for diabetic patients in the COVID-19 era is, according to me, a challenge because people with comorbidities now with this black fungus or the mucormycosis and the candida, people are afraid to come. So retina specialists face the unique challenge of caring for the patients that are at high risk for diabetic blindness during the era of COVID-19. And pandemic-related concerns are affecting our diabetic patients, diet and lifestyle, and even their ability to access medication and routine medical care. This is actually during the total lockdown, which was there last year. But partial lockdown, many things have been cleared, but still people don't want to come. And the COVID-19 lockdown is threatening the sight of thousands of people, as eye clinics have reported more than 70% reduction in the new referrals and a high rate of missed appointments. And this has been published by the UCL by Tufail Adnan in a paper saying a few million are not able to take appointments for diabetic because every clinic was closed last year. And the COVID-19 pandemic and associated safety measures have prompted a change in the provision and delivery of eye health services, which every hospital did that. And a large number of vision programs have been temporarily suspended, including mobile eye screening exercises and non-emergency surgeries in an attempt to reduce the risk of exposure to COVID-19 for both patients and health workers. I think it will opened up from October. Several concerns have been raised regarding proximity of eye care professionals to patients during eye examination. The pandemic surely has implications both of eye health and eye care professional. And there was a session of COVID-19 martyr session about 11 to 12:30 by Partha and the Governing Council. I think around 160 ophthalmologists who are members of AIOC have died in the COVID. It's really sad to see so many ophthalmologists have died. And consideration for serving this vulnerable population during an evolving crisis, communicating to patients the precautions your practice has taken to ensure that safety can be a critical component in easing patients' fear, providing guidelines referring doctors, greater reliance on imaging technology, and communicating to patients all the precautions they have taken to ensure their safety has been a critical component to ease patients' fears, mass communication, reach out by phone to patients who are scheduled for treatments to confirm appointments and explain the new protocols. And this was last year where I learned from, I think one of the earliest was Arvind Hospital. I heard Shushusha, Shankar did this videos in the last year. So, and we had to do all this. Even now we do, but we don't have to follow the same extra precaution which we were doing during the total lockdown. And we did close the hospital even for a day, and where there was skeleton staff, doctors available, and this was the time when it was a total lockdown. And I saw videos from Natarajan, Arvind, and just cleaning of instruments and the staff wearing the plastic shield to examine patients is even now carrying on. And during the last year, the only emergencies were taken. And teleophthalmology we tried, but somehow it didn't work the way I wanted. And this is the precautions taken. And even today, my anesthetist says better to wear the PPE and operate. So I have a PPE, and then over that we wear the sterile gowning. And then I know I wear 3D. I do 3D surgery, so I have the 3D glasses. Even today I'm doing this. Today morning also I was asking the anesthetist, is it really required to do all this? And maybe during the end of the talk, we can find out whether it's really required to do OT procedures like this. Even though as a retina surgeon, we are spending a lot of time. Anesthetist says better to do that because they are in the operating room and we are close to the patient. So I think all this I'm still doing it because of the COVID, and that this is what. And we had to do all this to tell the patients that they are following, and coordinating with referring physicians, encourage referring physicians to capture and share with us the ultrasound wide images of patients about whom they are concerned. Reviewing the ultra-wide phase images help us determine how urgently this patient needs to be seen, or if they can instead be managed by the referring doctor. So we are doing through WhatsApp and Zoom
linkage,
and improving clinic efficiency. And also this is what we are trying, and we are doing that in the last even during the partial lockdown we have started. It's slow. The Bombay Municipal Corporation clinics are open, so we are doing the screening awareness,
and
capturing of images and uploading, diagnosis and real-time advice by the ophthalmologist or the using the AI or the offline AI. And then innovative, this is a diabetic retinopathy care model where we have the pioneers, Dr. Rajiv Raman, Kim Sabyasachi, and Dr. Subudhi doing. Dr. Raju and Biju Raju also have done a lot of like this handheld device, and also portable fundus camera. This is a remedy. I don't have any financial interest, and this is again to show fundus on phone and size. We carry this instrument in the motorbike and go all over, either the forest camera or the Remedio. And then the challenges post-COVID, the COVID-19 related lockdown was related to the postponement in patient care, which resulted in significantly worse visual acuity outcomes in patients with diabetic retinopathy. Somehow, because one eye is all right, they come so late, even today, every day they come, one eye has vitreous hemorrhage, and the other eye is having pre-proliferative diabetic retinopathy. They come, ask them, why didn't come? No, because of COVID. And consequence of lapse in anti-VEGF therapy during COVID-19. Despite the efficacy of anti-VEGF treatment in resolving gross anatomical derangements, the damage done to the retina on a cellular level and the deterioration of visual acuity after lapse may, in many instances, be irreversible. Very difficult to convince the patient, because when you send videos and call, they think that you are doing marketing and you are trying to call patients to make money. So sometimes I tell the patient, it's up to you. My staff gets a little disappointed, saying, they tell me, don't call. I said, all right, make a note and enter in the computer. I said, leave it. Information regarding visual loss that can occur with lapses should better be counseled the patients on the consequences of loss to follow. Maybe all of us can compile the data and maybe publish, and also publish it in the newspapers as a general saying that if you neglect eye care, particularly the diabetic, you have a problem. The pandemic is not just a challenge for health system, it is also a socioeconomic burden, because the gap in eye care impacts everything from education and personal mobility to road safety and prospects for employment. This is why our current reality should not inhibit our ability to generate a new paradigm for infrastructure, distribution of eye care providers, and eye care setting. There is indeed so much to speculate as to what lies ahead. What is the future of eye health as the world adapts to the new pandemic landscape? And what will we learn from the pandemic and its lockdown? Only time will tell if we acted wisely. What we do know, however, is that everyone deserves an equal right to sight, no matter where they live. Hence, I suggest when you are doing that care, please make sure you protect yourself. So I follow this SMSV, that is to say S for sanitizing, M for wearing mask, and S for physical distancing or social distancing, and V for vaccinated. And after all that, you should follow the precaution. And I think we have to remain safe, because to look after ourselves, our family. So one is you have to have a holistic approach, be happy, and worries are there for everybody. So you're not alone. And make sure you call a friend. That's what I said in that morning session, and also on the first day in the leadership, that when you are, everybody will have some problem. So I have my own friends to talk about the hospital, the financial problem, the loan, paying the staff, people taking leave, or somebody. I think we had 50% of staff had a COVID and come back, fortunately, and somebody has a problem in the family. So I think we have to address everything, and a holistic approach is required for ourselves, for our family, and for the staff and staff family. I think that will help to combat this epidemic and come out safe. Because COVID will end one day, but it's not ending shortly. It may be there for a year, or maybe a year at least. And there's the American Academy opened up. I don't know whether any of us can travel, even though I have planned to travel, but I don't want to take any risk just for the sake of traveling. I know people ask me, are you depressed? I said, no, I'm happy. Now I know how to utilize my time. So one thing I do is I sleep at 10, try and get up at 5, do the morning exercise, then meditation, do OPD, then evenings webinar. On these 5 days, I decided be at home and be with all of you in all India.
Thank you. Thank you, sir. Thank you, Dr. Natarajan.